All right, we're here today. We just had Matt here for the whole week observing. He's in LACC Chiropractic College. Interesting story. He's actually the one that had the femoral artery injury in 2015. That's a case that we've used to show the bruising and so forth. So he's here today. I just kind of want to ask him some questions about what he thought of the whole week, things he learned, and so forth. But let's actually start with his story, because I want to make it, have him tell the story of how, his experience with the Electrons Plus and getting injured and then kind of deciding on chiropractic school. So kind of starting off, his mom, Tracy, who's a patient of mine, shot me the first photo of his leg after surgery. I think it was like right after surgery. And she basically asked me if there was anything I could do for him. Initial thought was, yeah, you can just rest, just heal from the surgery. But then I kind of thought, a little bit, from all the cases that I saw, every post-surgical case, I would see deficient tissues, and basically we can start with that. And so I said, just send him in and we can take a look at it. And so that's when I kind of took some pictures, just to see what the effect of running the energy field through was. So, I'd like him to tell the story, how it happened. Go ahead.
So I was playing college hockey, and essentially I took a knee-on-knee hit, just kind of a blunt trauma to my knee. And at the time, being a stubborn college hockey player, I just thought nothing of it. I was like, oh, that's a bad Charlie horse. And it was in the first period of the game, so I continued the game. And once the adrenaline of the game wore off, I started to actually feel like it was real bad, and I ended up calling my mom, but it was really late at night. Of course, she ends up answering, and she asked if I needed to go to the hospital. I was like, no, I'll probably just ice it and see how that works. So I did that. I woke up being able to walk better than I had that night, but then about an hour later, it was just like excruciating. I couldn't lay down without just being in so much pain. So I called her again, and she took me to the hospital, and we got in about, I'd say, I don't know the exact time, but like afternoon, evening. The next day is when I eventually got into surgery. But yeah, I got into the hospital. They were like, oh shoot, when they saw my leg, and they measured the pressure in my leg, and it was way higher than it should have been. So that's when they were like, okay, this is a lot more serious, and they rushed me in to get a fasciotomy to clear out. I had compartment syndrome, and they removed a 500 cc blood clot and drained a couple, like 100 or 200 more milliliters of blood after that. And yeah, and that's essentially that. And they were saying I was pretty close to just chopping my leg off from up here, so essentially my whole leg. But yeah, and then we ran into you.
Okay. Then I think he came in for treatment. Kind of say what, how you limped in.
Yeah, so I was on crutches. They told me I was going to be on crutches for 4 weeks. They told me I wasn't going to play the rest of the season. I had surgery on Halloween of 2015. And so my leg was about here, and I couldn't bend it any farther than that. And it was just swollen, obviously, from the post-surgery and everything. So I was pretty immobile, I would say, and I was walking in on the crutches, and then we would just get set up.
Yeah, we just kind of checked the myotomes of the leg. Surprisingly, everything was working. Everything was jumping. We checked psoas, VMO, all the ones in the lower leg, and It was like, oh, that looks pretty good. So what we did was just kind of massage around. You know, I took a couple pictures and massaged around the scar. I think he came up on a Saturday, came in again Monday, took another picture, and the bruising's already changed. And I was like, wow, that's kind of weird. And then he went back up to school for the week, and then came back on the weekends. And you know, we get 2 treatments, I think Saturday and a Monday. And I think it was like 23 days later, he can do a full squat, and I basically said, hey. And then basically I kind of released him. I think it was after 8 treatments, 23 days later, and I said, just go ahead and you know, do some strengthening work. And then I think when did you get back on the ice?
So naturally when they told me I wasn't gonna be able to play the rest of the season, I was devastated. I broke down, and I was like, I put a lot of work into trying to make the team that year. And
that was your senior?
No, that was my junior year, but I hadn't played the previous 2 years, so it's just like I worked hard to get to that point to where I could play again, and it just being shot down like that, I was like, this sucks. So I was pretty devastated when they told me that, but then when we started working and I was all of a sudden moving a lot better, it was exciting. And so we had this surgery on Halloween, but then it was, I think it was December 21st, because I remember that was like one of the first days after, on our Christmas break, me and my brother and my friend, we went to an open hockey to go skate, and it felt fine. I felt a little fatigued just because I hadn't been able to do what I've been could do before. So but it felt, there was no pain, felt fine. And then the season started back up again in January after our break, and I sat out the first weekend of our games, but I practiced with the team, and then after that I played every game to finish the season. So
cool.
Yeah.
So then, you know, the surgeons were worried about nerve damage and so forth. So there's a second part of this video where Matt has a brother, an older brother, Mark, who is finishing up naturopathic school up at Bastyr, and he's actually going to be joining our practice. So last summer, Mark calls me and said, hey, I got a couple buddies, can we come down and check out the machine? And that was last, I think, July or something. Yeah. And we had it in this room, and we had a couple of other practitioners here. And during the conversation, Tracy, Matt's mom, I said, hey, you know, that's the older brother, Mark, and that's Tracy, the mom, and you kind of ask that. And I think we have that on video. So then you finished up NAU?
Mm-hmm. I finished, so I going through school, my brother Mark deciding he wanted to go naturopathic. I was always into the sciences. I knew I wanted to go some healthcare route. I was debating going naturopathic like Mark, just because, you know, younger brother do what the older brother does. But then after this experience, I wanted to, that kind of set my mind, like I want to go chiropractic. I want to do what you did to me to other people and help people that way. So I decided to go to chiropractic school, and now I am close to halfway done.
So he's got another 2 years. He's on break this week and decided to kind of just shadow and then kind of watch what we do. Like, what have you seen this week?
This week I've gotten the basic gist of how to run a assessment and see how things work, how things don't work, how to treat the areas that don't work,
and actually, most importantly, how to show the patient where their problem is. You know, that's part of getting somebody on a treatment plan. You know, when the patient first comes in, they're kind of wondering, do you know what you're talking about? And with the machine, you get to kind of show them where it's deficient. And I think we had a really good hip pain case, and this person was complaining of pain right in the hip. So we kind of ran through the myotomes and found like the tibial nerve, so right behind the popliteal fossa, was just shut down. So we started waking that up, and so we actually before we tested the hip. So the glute med muscle was shut down, and you did a muscle test, and he couldn't hold it, and it would hurt. So we actually treated the popliteal fossa, got that firing, retested it, and the pain's gone, and we didn't even touch the hip. So doing things like that, being able to assess, treat it, and then take some movement that caused pain, and like we didn't even touch where it hurt. So, you know, having that ability with a patient is huge. You know, because, you know, doing functional movement assessment stuff, it's good, and like regular orthopedic testing is good, but you know, when you can show before and afters and the patient actually feels the difference, you know, when you touch it with the electrons plus, it's like, I don't feel it on that right side, and then you go to the left side, they feel it, and it's like, okay, that's your problem. And then once you start to work that tissue, sometimes that tissue will come back right in that first treatment, and then they're like, wow. And then taking another movement that they had pain with, you know, it's just a very powerful tool to see whether you actually made some changes into the body. What other cases? We had some headache cases, I think. We saw some stuff there. But you know, so I encourage, you know, any students or interested practitioners, you can always come down, spend a few days with us, and you can actually see how it works, and you know, how the patient reacts to it. You know, I got invited to Toronto to go treat in Toronto because some of the patients are going, you know, heading out this summer. You saw the whole crew, the referrals that came from one person, and they're all a member of this country club, and you know, country club atmosphere. They play golf, and they sit around and talk about their problems and what they've done for it. So you know, I'm not even really in practice, but the week prior I got 6 referrals because of the stuff that we do here. So very powerful. You know, he's going to be graduating. He's going to be looking at tools to how to grow his practice, and this would be probably one of the better tools that you can kind of show people where the problem is, make a difference, and then, you know, have them refer because, you know, you've kind of done a good job. So anything else you want to add there?
I think I'd say you summed it up pretty well, but yeah, I saw everything you were saying. The patients coming in, they talk to each other outside, and then they were saying like, yeah, he referred me here.
Yeah. And then also, you know, it's, you know, I like to put like real case studies. You know, we'll hashtag him, and you can contact him. As a company, I never want to put like testimonials like, you know, John H. from LA. Like, you know, is that a real person? All the case studies that we put on Instagram or that we present, they're real people that you can contact to kind of get their story. So yeah, I mean, it's kind of a testament. As a patient, he receives, he knows the benefits, he decides to go to chiropractic school, and most likely he's going to be using this when he gets out of school, because, you know, he's been a receiver of it. So okay, so, you know, we want to just share these stories with you, and you know, reach out to him and so forth. So okay.